Hi, I'm Dr. Michel Vishion with the Center for Performance Medicine and Rehabilitation. I'm a chiropractic physician and actually director here at this facility. I work with Dr. Catherine Doty, who is triple boarded medical physician in pediatrics, pediatric rehab, and adult rehab and pain management. Thanks for joining us today. And it's a beautiful day out there, so I hope you're at a location where you're getting some sun and enjoying some of this beautiful weather. Today we're going to talk about girls soccer. Girls soccer has become a huge sport in the last 10 to 15 years. We've seen the growth in that sport, not only with the little leaguers, but actually worldwide and with the Olympic athletes and all the publicity they've gotten. So today I wanted to talk about preventing common injuries. And the things I'm going to be talking about today, there's actually more injuries that unfortunately go along with that, but we're going to be really focusing on the injuries from the waist down. So let's talk about the popularity of soccer. Around 3 million kids are playing soccer in the U.S. Girls clubs are participating up 37% than 20 years ago, okay? And girls high school soccer plays up to 45% more since 1999. So the popularity of the sport is just exploding. We see with our young athletes that the time that they're dedicating and the competition levels just continue to get higher, and higher. And when that happens, that means that there's more demands on the body. And those demands, unfortunately, can cause injury. So let's get into that. More popularity, more players. That means more injuries, like we had talked about. So we're going to talk about knee injuries. We're going to talk about quad and hamstring injuries. Remember I said everything below the waist. 65% of the NCAA women's soccer injuries occur in the lower limbs. So hips, knees, ankles, quads, hamstrings, hip flexors. These things are very common, and we're going to see exactly what happens and why that happens and what we can do to make that better. So when you're looking at girls, when you're comparing girls to boys or men to women, we are anatomically different, right? Everybody would agree with that. And we're actually structurally different. And our muscles are different and all these things. So it does have different injuries that can occur comparatively to a boy that is playing soccer or a female that's playing soccer compared to a male that's playing soccer. We're going to talk about some of those structural differences as well as muscular differences that challenge our female soccer players and make them prone to certain types of injuries. So, structurally speaking, girls are more likely to have injuries to their knee playing soccer than boys are. And we're going to talk about the pelvic bowl, and we're going to talk about what's called the Q angle. Those are two structurally big things that we see when we're looking to actually rehabilitate an injured player, or we're actually looking for performance or prevention training as well. So we're going to take a little anatomy lesson here. And we can see this is the female pelvis and this is the male pelvis. Now there are some major differences. I don't know if you can see them, but I can definitely see them. But you can see with the female, the pelvic bowl or rim area, you can tell that it's actually a more oval or elongated shape. So that's typically going to make the hips wider, okay? Males are more of a heart-shaped distribution, and it actually is more narrow, which actually makes the hips narrow. And that's really important when we're going to be talking about what's called a Q angle, is the angle between the hip and the knee. You can see right here at the lower part of the subcubic angle is greater also. So if you can imagine that there's a bone that comes up into here that connects here, that also comes down and connects to your knee. So what is a Q angle? Okay, it is actually the measurement between the hip to the knee. And that angle that is created, as you can see, women typically have an average of an 18% angle compared to men with a 13% angle. So it can cause pressures on the lower part of the body to be greater because this angle is greater. Also, from a muscular development phase, women have more of a tendency to build quad strength in the outer part of their leg then their legs symmetrically. So that's one thing that we really need to focus on when we're dealing with a patient that is post-op, or we're dealing with a patient that had a sprain, or if we're dealing with even performance training or prevention training. So you're 4 to 8 times more common for women to have a tear in the ACL versus men for this very, very reason. Almost always leading to osteoarthritis 20 years after the injury. So I know I don't want to be doom and gloom, but we need to be realistic. If you're an athlete and you're looking for longevity, you're looking to play high school, you're looking to play college, possibly you want to excel to be an Olympic athlete. There are things that you need to do to make sure that you have injury prevention, as well as make sure that you're properly rehabbed, because unfortunately what the statistics tell us is if these injuries aren't essentially addressed properly, or even if they are sometimes, it's going to cause these terrible side effects of arthritis. So when do these injuries happen? Well, 70% of ACL, which is anterior cruciate ligament injuries, occur without a collision, okay? I know when we talk about football, we think about that guy getting hit, and all of a sudden his knee's blown out. In this situation, it is not that way. That's why sometimes it's so frustrating. It's that quick change in direction, or that quick pivot that occurs, that all of a sudden the player goes down and everybody's looking around going, what happened? What happened? And that's how fast it happens. One of the very important things that we look at when we're going to address a knee, either post-op, injury prevention, or performance training, is looking at something called neuromuscular training. Neuromuscular training, or neuromuscular re-education, is extremely important, especially making sure that the muscles in the hips and the core musculature and the muscles in the quads and in the hamstrings are all equally balanced and actually firing at the same time as well. There are things called muscle firing patterns where when you kick, there is a certain sequence of how those muscles are going to need to fire. And if they aren't all firing at the same time, or in the right order, or reversed, that can cause injury. That can cause decreased performance. So training at the proper time. Research indicates starting early neuromuscular training before puberty, okay, is better than waiting until an adolescent or an adult. Why is that so important? It's because your body is laying pathways into the brain. It is laying those important pathways that tells your body how you are moving, what's your postural sense, and in what direction, without you relying on your eyes to tell your body that movement. Also, extremely important during the growth phase, because as your body grows, okay, as you grow, you actually grow explosively.